What's really interesting about artificial intelligence and the future of imaging is that AI is actually already here, right? AI is already impacting the care that we're actually providing, whether it's on the modality side all the way to the way that we're interacting with patients. So the future is here, it's just not evenly distributed yet. So the imperative for us as an industry is to really make sure that we're able to, I call it, inoculate ourselves from the shiny object syndrome. Because there are lots of shiny objects out there, specific tools that are kind of cool, but at the same time may not have an impact as broad as we want for it to be. So it's important for us to ground ourselves in the reality of what it is that we're trying to really do, which is we're trying to transform the business of healthcare through imaging. Artificial intelligence, in many ways, then becomes a natural complement to that transformation that we're talking about, if we're able to do it right. So it's an opportunity for us to capitalize on all of the developments that are happening in artificial intelligence and to really rebase our specialty overall, right? I think what we can do with AI is for us to really augment the care that we're providing to our patients, to increase the collaboration that we need to have in place across the care teams, and for us to really humanize healthcare, for us to really connect with the patients. It's an opportunity for us to free ourselves from the chains that have been holding us back in the volume-based methodologies of the practice of radiology, and really have those conversations, have those connection points with our colleagues, but more importantly with our patients. When it comes to innovations in AI and patient care in general, I think there are lots of innovations that are coming to bear, right? We're seeing innovations in AI as they're embedded directly into the modalities. We're seeing innovations in AI on the workflow orchestration layer, on the visualization layer, but also on the layer of care delivery across the board. So it's impacting the entire value chain. I think what's really missing right now, to be quite honest, is innovation on the business model side. And that's different from innovation in terms of pixel-based data around AI or machine learning capabilities. We have all of that, and there's more of it that's going to be coming at us in the next couple of years. But I think now is the time for us to really get creative and innovate around the business models. And what I mean by that is that we're constrained today by the business models of volume-based imaging. Right? And what we're trying to do is we're trying to out-innovate ourselves within the confines of the existing business model. And I think what we really need to be doing are coming up with creative ways to really look at how do we make doing the right thing for the patients the easier thing, as well as the more business savvy thing, because today that's not the case. So I'm really excited about that. So one of the biggest challenges of the adoption of AI within healthcare more broadly is the fact that data is everywhere, but at the same time, we're lost in the signal to noise ratio, right? So I think it's really important for us to connect multiple different sources of data. I'm a big believer in three things. One's busting silos, right? So we've got data silos galore across imaging repositories, structured, unstructured data repositories, and then information that we don't have access to today within health systems, including patient preferences, including zip code data that are stronger deterministic factors of outcomes than anything else. So we got to bust those silos. The second thing is we need to build those bridges, right? Across those silos, across care workflows, across those care teams. And then the third thing really is we need to change the culture of how it is that we're practicing medicine today. And it really needs to go back to the core element of how do we put the patient front and center? How do we put our end users in the very design of the solutions that we're creating, right? Engage those end users early and often and iteratively throughout the process. And I think that's what we need to do to really make sure that AI and healthcare technology overall has the biggest impact as we think forward in what the future of radiology really is.